presidential race, the latest October surprise will hit millions of Americans in their pocketbooks and wallets. Insurance premiums on Obamacare exchanges will rise an average of 25% on the federal exchange next year, a steep jump from years past. For Republicans, it's confirmation of their opposition to the health care law. So how did this happen? After President Obama's health care plan went into effect 6 years ago, insurance companies found that new enrollees were sicker and therefore pricier than expected, which forced some insurers to raise premiums or to pull out of the state-based insurance exchanges because they said they could no longer afford it. The average premium hike for 2017 will be 25%. For some states it will be less, for others, such as Arizona, much more. Consumers in Arizona will pay an astonishing 116% more on average. And those who don't have insurance next year could face tax penalties of $700 per person. Donald Trump today seized on the news of the skyrocketing premiums in an appearance with employees of his Florida resort.
Obamacare has to be repealed and replaced, and it has to be replaced with something much less expensive for the people.
And he raised questions about his employees' coverage.
I can say all of my employees are having a tremendous problem with Obamacare.
The Trump Resort's manager later clarified that 99% of the Trump employees are insured through the hotel, employer-based insurance, thus not impacted by these hikes. In fact, the Department of Health and Human Services says that the premiums for employer-based insurees have not gone up as much as they otherwise would have because of all the new people enrolled on Obamacare exchanges. The White House today argued that while the 10.5 million Americans on Obamacare will be impacted by the rate hike, 85% of them will be eligible for some form of tax credit. But that still means millions of Americans are seeing their premiums go up significantly, as noted a few weeks ago by none other than former President Bill Clinton.
So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people are out there busting it sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world.
Trying to balance her support for a popular President Obama with the unpopular jump in Obamacare premiums, Hillary Clinton has said she would defend but fix Obamacare. But this October surprise is one that voters understand and one that Trump is seizing on, as are other Republicans, such as New Hampshire Senator Kelly Ayotte.
Maggie Hassan supports the health care law that is hurting New Hampshire families.
Our costs have gone up over 47%.
Health insurance premiums are expected to go up yet again, right before the midterm elections in November. Now this, after a battle in Congress failed to include in last week's massive spending bill a plan to shore up the health insurance exchanges. No subsidies. And without the government money, insurance companies, well, you know what they're going to do? They're going to raise rates, right? Jerry Willis joins us live from the newsroom with the latest on this. Jerry.
Well, Ash, you've got that story right. Estimates of just how much premiums could rise, according to the Congressional Budget Office, some 10% for a popular middle-priced option on the insurance exchanges. And, you know, that doesn't even include the hike to premiums that will likely occur as the mandate fades away. Now, lawmakers on both sides are pointing fingers. Democrats blame the GOP for the failure in negotiations, saying they demanded abortion restrictions be included, something they knew would be unacceptable to Democrats. And Republicans say this, that they negotiated in good faith, and Democrats rejected reasonable rules on abortion. Either way, the impasse means money to shore up the Obamacare insurance exchanges was omitted from the $1.3 trillion spending plan that the president signed last week. Failing to shore up the exchanges could have big repercussions at the ballot box. A recent poll in Pennsylvania showed healthcare was a top issue for 52% of voters, according to public policy polling. Payments to insurers were stopped last year after President Trump said they were illegal because the money had not been appropriated by Congress. Meanwhile, insiders say that passage of legislation to stabilize the exchanges, highly unlikely. Ash, back to you.
Interesting stuff. And bottom line is those rates go up. Jerry, thank you very much.
First, Congress eliminated the individual mandate requiring almost all Americans to have coverage or pay a fine. Second, the expected expansion of health plans that don't adhere to health care regulations. But there may be a silver lining.
Yeah, 7 Eyewitness News reporter Ed Riley is helping you make ends meet tonight. And he tells us that silver lining may be linked to the fact that you live here in Western New York.
Medicine used to be $5, now it depends on a tier of your medicine.
The rising cost of healthcare is making it hard for many people, like Salah Steya and his family.
Well, it affects family income because when you have family like mine, I have five people live in the house.
Others told us that prescriptions can be so expensive that they have to choose to go without.
Especially for the elderly, it's a major concern.
Now, more concerns. According to the New York State Department of Financial Services, health insurance companies who sell to individuals through the Obamacare exchanges are seeking an average increase in New York State of 24% next year.
I think it's terrible.
I just wish they would stop gouging.
The insurance industry points the finger of blame at regulatory measures such as Congress ending the penalty for those who do not buy health insurance. It's feared young, healthy individuals will drop coverage, leaving insurance companies with an overload of sick people and high expenses.
I think it's always a concern when the size of the pool is shrinking. It creates more volatility as the pool becomes smaller.
It is not the only factor. According to Univera Healthcare, there are still too many people living unhealthy lifestyles. When they do get sick, it's costing insurance companies a lot more.
Those health decisions and behavioral factors influence about 90% of what you're paying for with your insurance.
Univera is seeking a rate increase of 2.9% for individuals, much less than the state average. And the company said the strong competition between Univera, Blue Cross Blue Shield, and Independent Health is keeping hike requests lower in this part of the state.
They will have a variety of options, not just among competitors, but within each competitive plan.
It will now be up to the State Department of Financial Services to take a look at the proposed rate hikes to see if they will be approved or need to be modified. In Buffalo, Ed Riley, 7 Eyewitness News.
So what exactly is universal health coverage? Well, it's an idea, and it's a powerful idea, and here it is. Imagine a world in which all people can access the healthcare services they need to either stay healthy or improve their health without suffering financial hardship. So what's not to like, right? It's the kind of idea that you can get behind regardless of your political ideology or leaning. You don't even need to be Canadian to get excited about universal health coverage. So let's unpack this a little bit. Think of universal health coverage as a pooled fund, and this pooled fund can come from a variety of sources. So it can come from general government budget, it can come from compulsory insurance contributions, and it can come from voluntary health insurance. And then these funds get used to address the 3 dimensions of universal health coverage. And these 3 dimensions are, number 1, the proportion of people covered, number 2, the proportion of costs covered, and number 3, the range of services that are available. And of course, policymakers need to make decisions, and of course they need to make trade-offs between these dimensions. And they make those trade-offs in a way that maximizes the extent to which people's healthcare needs are met and avoids catastrophic healthcare expenses that can lead to impoverishment. And so the idea of universal health coverage is really that it's an idea that is in contrast to its alternative. And the alternative is that healthcare is just another good or service that can be dealt with in the marketplace. Now, there are some goods and services, and in fact most goods and services, for which the marketplace is excellent. Healthcare is just not one of them. So the price and quantity of iPhones that get bought and sold, fine. Works really well in the marketplace, leave it there. But there are circumstances, and there are goods and services for which markets tend to fail. And healthcare happens to be one of the best examples of this. Now, I'm going to create an entire separate video that gets into the economic theory as to why it is that healthcare markets tend to fail. And in that video, I'm going to talk about things like adverse selection, information asymmetry, externalities, and supplier-induced demand. All you really need to know for now is that the economic theory predicts that healthcare markets will fail. And the empiric evidence, the data, the natural experiment that's already been done in the world confirms just that. A healthcare system that relies too heavily on private healthcare service provision is not only extraordinarily expensive, and the empiric evidence demonstrates that, but also at a population level produces very poor health outcomes, and the evidence and the data support that conclusion as well. Now, I'm not saying that there's anything wrong with private healthcare services. I have private healthcare insurance, but I'm delighted to live in a country where if I were to lose my job or fall into financial difficulty, that my family wouldn't be in harm's way. And if I feel that way, how much more must it be the case for small business owners and entrepreneurs who really form the backbone of the economy? In fact, universal health coverage is arguably one of the best things that you can do to encourage the entrepreneurial spirit and to grow the economy and create jobs. But of course, that's not the reason why it's a beautiful idea. The beautiful thing about universal health coverage is that it protects the poor and the vulnerable and prevents people from falling into poverty. In the US, for example, the number one reason for going into poverty is unforeseen healthcare expenses. Now, of course, the scope of services that any given country can afford to offer its people is a function of what that country can afford. And so a lot of thought needs to go into identifying the most cost-effective combination of services to meet the needs of people, given the financial constraints that all countries work within. And DCP3 supports just that kind of decision-making. What is DCP3? Well, I'm glad you asked. DCP3 stands for Disease Control Priorities, 3rd edition. It's a 9-volume series. It promotes the use of economic evaluation for priority setting for across the world, especially in developing countries. DCP3 has been developed by experts in health from across the world, and it's been led by a team at the University of Washington's Department of Global Health. Find out more at dcp3.org or click on the link in the description below. And incidentally, DCP3 are sponsoring this video, so a big thank you to them from me. And by the way, this actually works. I mean, we've seen countries from across the income spectrum, from Ethiopia to Indonesia to Thailand to France, implementing the principles of universal health coverage. And countries that make progress towards universal health coverage see, no surprise, improvements in health outcomes and reductions in catastrophic healthcare spending.